Hi, I'm Dr. Michael Banman from Align Life Medical, and I just wanted to take a couple minutes to share with you my experience with regenerative medicine and stem cells. Many people come into my clinic and they ask me, is regenerative medicine safe? Is it for me? Is it going to work? How much does it cost? And I can tell you that I've personally been through all those questions in the past because I had an injury happen to me doing something that I love to do and doing something that I thought was normal, but it just so happened that the way my body reacted was not normal. And so I know a lot of people out in our clinic that we deal with, they are asking the same questions. How come my body doesn't do what it's supposed to do? When I hurt myself, I was actually playing basketball in a men's league, just doing what I love to do. I went to turn my body and my knee shot out, and it felt really uncomfortable. It felt like someone had hit me in the leg, and my knee just didn't go where it was supposed to go. So of course I tried to get up and walk through it, and that was not a good thing. I tried to do something to help myself because I believed that, I could work through it or I could do something to make myself feel better. And I ended up walking over the bench, and then my knee buckled again, and I brought myself home. I crawled into the house, crawled up the stairs into my bed. I didn't want to wake my wife up. But it ended up that I ended up staying in my bed for 3 weeks after that because I couldn't put any weight on my knee, which was a big deal. I owned a clinic, I had doctors that I employed and staff that I employed, and I really cared about the patients that I was taking care of. And it was tough. It was a bad situation for me. And I've been practicing chiropractic for about 20 years almost now. And I have been telling people over and over again, at all costs, avoid surgery, medication, don't do these things. It came time for me to make a big decision. And I really thought that I needed surgery because I know that there's a time and a place for surgery. I know that you need to do it at some point if you get into a trauma or you have an emergency situation. So I went to see the doctor. They referred me to the specialist, the surgeon, and the surgeon told me that I actually needed reconstructive knee surgery, and my outcome would be that I wouldn't ever be able to run again. I'd never get my full range of motion back in my knee. And the reason they told me that is because I had torn my ACL, my MCL, and my LCL, completely torn them apart. And I had both my meniscus torn, my lateral and my medial meniscus. The medial meniscus had a bucket handle tear, which meant that I couldn't even straighten my leg out. And it was so bad that I even ruptured a muscle in the back of my leg, my popliteus muscle, and it tore right apart. And also, I didn't even know about this. I learned something new about my knee, but there's a protection that goes between your kneecap and your MCL, your medial ligament, and it was also torn. So it was really bad. They said that was one of the worst knee surgeries that they had, or knee injuries that they had experienced. But they thought my prognosis was really good because of my age and because of how healthy my knee looked on the x-ray. But for someone to tell me that my knee was healthy and for what I was actually feeling and going through, it was terrible. So I decided that I was going to actually go ahead with the surgery. I had a little bit of time to wait, so I started looking more into stem cells. I'd been referring patients in my clinic to stem cell clinics around the world for about 10 years. And they had to go out of the country because that's the only place that they were available. So I started to learn that now it was becoming more available in North America, particularly in the US. And I decided that I was going to take the plunge and go and do it. I didn't know as much as I know now. I didn't know if it was going to work for me. I had all the same questions that you probably have. Is it going to work for me? How much does it cost? What are the outcomes going to look like when I do get it done? Is it going to hurt to have it done? So the biggest part about this was I had promised my wife that I would take her to Hawaii for her 40th birthday. And my injury happened to come just before that. And it was terrible because I felt horrible. We had planned this trip and it was going to impact my family, it was going to impact her, and I really wanted to get back on track because I like to be active. I like to be moving, just like a lot of you people do. So it so happened that our trip was at the end of May to go to Hawaii. And May 1st, I had my procedure done. And I actually walked in to have the procedure done on crutches because I couldn't even put weight on my leg. And I'm telling you, this is my experience. And now the experience of a lot of people that we see in our office. 3 weeks later, I was on a plane to Hawaii with no crutches. And I enjoyed having a wonderful vacation with my wife. 3.5, 4 weeks after this procedure was done, I was completely mobile and moving around and swimming in the ocean and doing the things I love to do. So when you think about these things, there's some really important questions to ask. What is your priority to your health? And regardless of the cost, is this worth doing before doing surgery? And my thinking was, my plan has always been, I've had a plan. My plan has always been that I'll do whatever it takes to avoid surgery. I didn't know what that meant until I suffered an injury myself. And when I did suffer the injury, I still tried to stick with my plan to the best of my ability. And my thinking was, I can always have surgery later, but I can't do the surgery and then undo it once I've had it. So to me, regenerative medicine has changed my life. It's absolutely transformed my health, and I will continue to make it my mission to help as many people as possible avoid surgery and drugs so that they can experience a good quality of life as they get older or even when they're young, so that their life will be fulfilled, their purpose in life will be fulfilled in a more natural, less invasive way. So I just want to thank you for listening. If you have any questions, we'd love to answer them. If you have any comments, please comment below. And if you need to get a hold of us, I'd love to speak to you personally. And I'd love to share with you what we can do to help you get better. Thank you.